Hello, everyone. A warm virtual welcome to all of you that have logged on. My name is Suda David Wilp, and on behalf of GMF, I'd like to welcome you to our weekly coronavirus update, which alternates weekly between views from Europe and the United States. Today, we have an expert panel from the United States to discuss community challenges and local responses. We're really grateful to have Jason Wynn Hughes with us today. He's taking the time to be with us. He's a state representative from the great state of Louisiana. His district is Eastern Metro New Orleans, which is unfortunately a hotspot of the coronavirus. Jason is also Chief of Staff and VP for Global Public Affairs and Partnerships at the African Diaspora Consortium. He's held many senior positions in public service within the offices of former Louisiana Governor Kathleen Blanco, Senator Mary Landrieu, and former Mayor of New Orleans, Mitch Landrieu. He is also an alum of GMF's Marshall Memorial Fellowship. Thank you for being with us today, Jason. We also have my former colleague, the great Geraldine Gardner, who led GMF's initiatives to convene policymakers and practitioners from US and European cities to explore key issues in the transatlantic urban agenda. She's now executive director of the Centralina Council of Governments, as well as a visiting fellow at GMF, so she's still with us, and an adjunct professor at Georgetown. And finally, last but not least, my current colleague, Alandre Dedrick. He is with our leaderships programs. He focuses on inclusion and diversity. And he's also doing a lot of research between Europe and the United States on how social networks are used for stakeholders in government, business, tech, and civil society to talk about urban renewal policy. So I look forward to hearing from the panel about their local on-the-ground perspectives, and we'll definitely take your questions later on. Please use the Q&A box at the bottom of your screen and note that this is being recorded. I will look for questions, and if you want to also identify yourself, that would be wonderful as well. And we will also then, if you have a direct question for a panelist, also please point that out in the text. So I'm going to start off with you, Jason. You've had ample experience in the state and local level. How do you rate the coordination thus far between local authorities and the federal government? Where is the federal government sorely needed, and where is perhaps the federal government not needed? Like, where would you like them to perhaps mind their own business?
Sure. Well, thank you very much. And let me first thank the German Marshall Fund for hosting this very important conversation. As you said, I've been involved in this work now for almost 2 decades. I have, seen natural disasters. I've been through 4 hurricanes working for elected officials, and now going through this pandemic as an elected official myself. Unfortunately, I will say here in Louisiana, state and local coordination has been extraordinary. Unfortunately, there have been some gaps at the federal level. Now, those gaps have improved over the past days and weeks. But if we go back to February, at a time when the state of Louisiana and the city of New Orleans hosted Mardi Gras, we hosted Mardi Gras on February 25th, and the Mardi Gras season commenced 2 weeks prior thereto. The federal government was part of our local planning team, and there was absolutely no guidance from the federal government at that time, be it from the White House or Centers for Disease Control, to cancel or postpone Mardi Gras. And obviously what we found here in the city of New Orleans is that Mardi Gras really created an unfortunate situation here in our city. Our city is very compact, very small, very dense. And now we have one of the highest per capita death rates, not only in the country, but in the world. And so initially there was no guidance from the federal government. And as our diagnosed cases increased, as our death rates increased, and as our hospital capacity looked very, very bleak, unfortunately, the response from the federal government getting us additional hospital beds and ventilators was very, very slow. And so we've had to get very creative in the city of New Orleans, forming strategic partnerships with our businesses throughout the state to get ventilators built and get hospital capacity increased. So I'm hopeful that as we continue to navigate this pandemic, that the federal response and federal coordination will increase, but initially it was wholly ineffective.
Mm. And I mean, what is the situation right now for the city of New Orleans? I mean, I've been following the news too for the past couple of weeks. I mean, have you hit the peak yet? Where do things stand right now?
Yeah, unfortunately, it's a very bleak situation in the city of New Orleans. Spoke to the mayor yesterday. We speak daily. Unfortunately, we don't think we have quite hit the peak. Now, the mayor has issued a stay-at-home order. Yesterday, she extended her stay-at-home order through May 15th. And the reality is that stay-at-home order is likely to be extended once again. The governor has also issued a stay-at-home order through April 30th, which is likely to be extended. Just to give you really quickly some perspective about New Orleans, we have over 5,800 diagnosed cases in the city of New Orleans. We have almost 300 deaths. So almost 5% of all citizens that have been diagnosed ends in fatality. We have 27% of all diagnosed cases in the state of Louisiana, right here in the city of New Orleans, and roughly 30% of the death rate is right here in the city of New Orleans. Of all of the deaths in the state of Louisiana and the city of New Orleans, unfortunately, 70%, 70% of all deaths are unfortunately Black populations or African Americans. And so that's a very bleak statistic. The mayor has canceled all festivals and large events in the city of New Orleans for the rest of the year. So no Jazz Fest, no French Quarter Fest, no Essence Fest. And the reality is we're going to have a very tough conversation to determine if we're even going to host Mardi Gras in 2021, because the Mardi Gras season will commence in January 2021. And so we're going to have to make some decisions. So schools remain closed. They will remain closed for the duration of the school year. Colleges are 100% online. Our city is 100% shut down. And, we are a tourism-driven economy. So not only are we dealing with the impacts of COVID from a healthcare perspective, but our economy is suffering, people are suffering. And so we're going to have to figure out, how do we get families back to work, and how do we keep people afloat throughout this pandemic?
Thank you very much for giving us a snapshot of what's going on. I'm sorry to hear such a bleak, picture of the beautiful city of New Orleans. But I mean, maybe we can move on to Geraldine on that note. How Jason, I mean, it feels like people feel maybe powerless, not just because of the health pandemic, but also because of the impending economic distress. I mean, Geraldine, tell us a little bit about your organization and, how can communities come together? How can there be sort of regional cooperation during this time where people feel a little bit, helpless and know that the storm is going to take a while for it to pass?
Yeah, thank you, Suda. And I just want to send warm greetings of health and wellness to the GMF family and to all of you who have joined the call. I got a chance to get a sneak preview at the folks that have RSVP'd, and I saw a lot of familiar names, a lot of local leaders on that list, and just want to express my gratitude and appreciation for the service that you're all are doing in your communities, whether here in the United States or abroad in Europe. I think if we've learned anything from this crisis so far, it's that we all have to be very adaptive and fluid, and it's really easy to look back and talk about what we could have done and what we should have done. But so many of our local leaders are focused on the here and now and looking at what's going to happen into the future. So my organization is called the Central Louisiana Council of Governments. We serve the 2.5 million people who live in the greater Charlotte metro region. It's an economically, socially, politically diverse region. We have 9 counties. We share a border with South Carolina. So from an economic perspective, we're a bi-state region, even though my organization serves the local governments that are in the North Carolina side. And our mission is really to steward regional collaboration and coordination so that we can all create an opportunity to improve quality of life and expand opportunities for residents and businesses and local governments across our region. So this crisis has really tested local governments in new and different ways. Unlike a hurricane or a tornado, or similar types of crises that we face, they're time and space bound. You get hit, you get pummeled, and then you move and pivot into recovery. And I think what we're finding, much like the economic recession from about a decade ago, we are very much focused on the relief efforts and the public health crisis. At the same time, we have to have our eye on the recovery. And that's part of my frustration with the federal, state, and local dynamics, just to build on what Jason talked about. If you look at the federal government's response in the most recent $1 trillion stimulus act, the CARES Act, there's about a $1.5 billion set aside in that bill for state and local funding. And kind of in an unprecedented move, in my opinion, the bill sets aside a specific amount for cities and units of local government over 500,000 residents. And it's really, in my opinion, an arbitrary number. And states have the opportunity to receive that money, but the localities, the units of local government over 500,000 sort of have first crack at the funds, and they have to apply directly to the U.S. Treasury by midnight tomorrow night to receive those funds. So you have this really strange reach down from the federal level to the direct local government unit level, bypassing the states. And in the state of North Carolina, of that 150 billion, 4 billion is allocated on a per capita basis to our state. We only have 4 units of local government in our state that qualify for this $500,000 or 500,000 person threshold. So that means 4 communities, Wake County in the Triangle area, Guilford County in Winston-Salem, Mecklenburg County in my region, and Charlotte, have the opportunity to pull down these resources. The balance of what's remaining gets spread out across the rest of the state. So you have this very strange conflict between the federal government role asserting itself, the state role saying that we have the power of the purse to control these resources and deploy them where necessary. And that's creating a lot of conflict on the ground and competition within our state, frankly, for much needed resources. The other point of frustration, that just in a very practical matter, states across our country are required to have balanced budgets. So if you look at the decision by the IRS at the national level to push back the tax deadline to July 15th, that was a great move from a personal and individual level. But what that's doing is that's putting incredible strain on local government resources. And states and local governments in our country have to have balanced budgets. So when your revenues are decreasing because sales taxes revenues are decreasing, property tax and income tax revenues are decreasing, states and local governments are going to have to start laying off employees. That's one of the only ways to balance the budget, unless you're increasing taxes on people, which no one's going to want to do in a recession. So you're going to have a depletion of the manpower and woman power needed to help our communities because of that. And so I think it's really, you're seeing a resurgence of regionalism and localism, people trying to work together to find solutions. I think that's only going to continue. It's been happening. I think outside of the capitals, people, or inside the capitals in Washington, people think this is a new localism, but it's really been there all along. Folks that I work with, the city managers, the county managers, the elected officials, they just don't have any tolerance for inaction and words right now. People are dying. And it's all about creative and adaptive solutions to respond to the crisis and think about recovery.
Alondra, both Jason and Geraldine talked a lot about sort of structural weaknesses within the United States that, we started off the year with a seemingly very strong economy, low unemployment, but unfortunately this pandemic has also sort of uncovered the weaknesses within our society. Can you talk a little bit about what Jason mentioned about how COVID-19 is affecting vulnerable communities, specifically African American communities, and also about, the role of government, whether at the federal level or the state level, and can Americans we feel differently about the role of government, but when there's that pandemic, you kind of need a big player to take care of the country. So maybe you can elaborate on a few of those points.
Yes, definitely. And I want to thank everyone for joining us here today to have this important discussion. As a program officer for GMF's Inclusive Leadership Hub and as a cultural anthropologist, I really want to emphasize the need to understand the disparate impact the coronavirus has had on marginalized communities across the world so that we as leaders can work together to confront this crisis as intelligently as possible. As more data has become available from states across across the US, racial disparities in the infection and mortality rates have become glaringly obvious. For example, when Maryland recently released its ethnic breakdown on COVID-19 cases, we discovered 49% of those infected were Black, and African Americans accounted for 53% of deaths, despite Maryland only being 30% Black. In New York City, the epicenter of the coronavirus in the United States thus far, 34% of COVID-19 deaths have been from the Latinx community, who only represent 29% of the city's population, and African Americans have represented 28% of deaths while being 22% of the city's population. So far for the United States as a whole, the data shows that 40% of COVID-19 deaths have been of African Americans. As a result, those outside the country have really asked two very important questions. Why are Black and Brown communities seeing higher rates of infection, and why are they disproportionately dying from COVID-19 complications? In order to answer both of those questions, we have to understand the long existing fault lines in our society that the spread of the coronavirus is currently exposing. So first, why are African American and Latinx communities more vulnerable to the transmission of coronavirus? The short answer is that increased economic precarity and rates of poverty make social distancing difficult and adopting certain recommended precautions risky. First, people of color are more likely to work the jobs now deemed essential that offer the fewest protections in terms of access to personal protective equipment, hazard pay, or sick leave. This includes grocery store employees, rideshare and delivery drivers, warehouse workers, as is the case of Amazon, healthcare workers, all groups who have been disproportionately exposed to the virus. Second, due to residential segregation and poverty, we see a higher reliance on public transportation and higher rates of housing insecurity and homelessness in Black and Brown communities, and thus less ability to practice effective social distancing. Third, there has been a lack of leadership at the national level and even at the state level in some instances, with over a dozen governors allowing church services and other social gatherings to proceed despite the stay-at-home orders. Combined with the spread of misinformation about the virus, in particular the conspiracy theory attributing the virus to 5G radiation, this lack of leadership has encouraged many to not take distancing guidelines as seriously as they should, while at the same time, the risk of racial profiling has many people fearful of wearing masks in public. As for the second question, why are people of color disproportionately dying? Once again, this is due to longstanding disparities in health outcomes because of residential segregation and medical discrimination. First, urban Black and Latinx communities are more likely to be located in neighborhoods with high levels of air pollution and exposure to industrial waste, leading to higher rates of asthma and other respiratory illnesses. Second, people of color are more likely to live in food deserts where there are no grocery stores or access to affordable, healthy, and fresh food. This contributes to higher rates of obesity, hypertension, and diabetes, all underlying conditions that have been found to greatly exacerbate the effects of COVID-19. Finally, over the past 20 years, both urban and rural hospitals and clinics serving low-income communities across the country have closed, and the remaining services are greatly under-resourced. Healthcare is still incredibly expensive and cost prohibitive, and millions remain uninsured, of which people of color number disproportionately. When you take this into consideration with the long histories of medical discrimination that continue to this day, leading to vastly different health outcomes for Black and Brown patients, it's more understandable why many are distrustful of healthcare professionals and are sometimes reluctant to seek necessary medical help. So when we really think about all of these various factors, we can see that in terms of both the transmission and mortality rates of coronavirus, people of color in the United States are impacted in ways that really necessitate direct and decisive action as soon as possible, and really a top-down approach, as you mentioned, from the national government to really confront this problem.
Okay, thanks a lot. You all have put a lot of issues on the table, and I've been, if you notice me looking down, it's because I'm looking at the Q&A box, looking for questions, and there are already a few in the queue. And I will go back to Jason, and I get a couple of few questions. One listener is asking about testing in New Orleans. What is the status of testing? Do you have enough tests? Is there contact tracing? And also, I guess his name is Alessandro here, based in Berlin, has asked about local organizations in New Orleans, and can there be innovative policies right now when there's just a lot of disarray and you're in the midst of a pandemic? That's his question.
Sure. So I'll take the first question first in terms of testing. I think we've done the best we could with what we have. The short answer is testing capacity needs to be more robust throughout the United States. And one problem that we've been seeing throughout the United States, many states do not have the capacity in their state labs to run tests. So they had to send tests to private labs. And in many cases, it took in excess of 10 days to 2 weeks to even get test results back. But here in the city of New Orleans, as of yesterday, we have performed over 18,000 tests. And that is the highest rate of testing almost anywhere in the world on a per capita basis. And currently in the United States, the city of New Orleans ranks second only to New York in terms of testing. So we have had robust testing here in the city of New Orleans. We've had drive-through testing where people could go in their cars, on their bicycles, on their motorbikes to get tested. And now what we're doing is, speaking with our mayor and our governor, realizing that our more vulnerable populations don't have access to cars. Public transportation is very scarce right now. So you literally have to meet the people where they are. And so we are about to launch mobile testing, where we will have mobile labs and mobile vehicles going into clusters where senior citizens live and where our low-income citizens live. I'll touch on innovation for a minute. I looked at the question, and thank you. It's a great question. New Orleans, as you know, is known for its food, its music, and it's one of the few places in the world where you can literally walk the street with an alcoholic beverage. We have lots of distilleries and lots of alcohol producers. Unfortunately, we don't have any tourists or residents to walk the streets right now. So we had to challenge our small business owners and our local business owners to think outside the box. A, how do you keep people employed? And B, how do you contribute to the city and to the state's recovery in a meaningful way? So our beer distilleries and our liquor distilleries right now, they're not producing beer and they're not manufacturing vodka, but realizing that there was a gross shortage of hand sanitizer in our hospitals and government, we now literally have beer distilleries producing hospital grade hand sanitizer for the city of New Orleans and the state of Louisiana. Our hospitals are ordering that. Our Department of Homeland Security are ordering that. It's keeping people employed, but it's also providing the necessary equipment that we need. PP&E, you hear personal protective equipment talked about a lot. And unfortunately, there was a growth shortage, not only in the city of New Orleans, but across the United States. And to Geraldine's point, unlike a hurricane where you usually have 1 or 2 or 3 states impacted, and you can rely on other states for help and for equipment, unfortunately, all 50 states are being impacted. And the federal stockpile has become a political animal. It depends on who says the nicest things about the president to determine who gets PP&E from the federal stockpile. and we had people dying. So we could not play the politics and wait on the federal government to send PP&E to our state. So we have furniture companies, we have universities, our career and technical colleges that have access to 3D printers. They have shifted their business models, and they started producing with 3D printers. They started making the N95 hospital grade masks that our frontline workers needed. They also started making the clear plastic masks that our hospital workers needed. So those are two examples of the innovation and strategic partnerships that we have had to rely on that has not only saved jobs, but has literally saved lives.
Well, I mean, that's good to hear the hope, that there is innovation going on and people coming together. A few more questions. I can pose this question to both Geraldine and to Alondre. One listener is asking about, hindsight is 2020. Is there something that the federal government or other authorities could have done when it comes to domestic policy or even foreign policy that could have helped the situation that we're in, or sort of mitigated the situation that we're in? I know that that's kind of a doozy. Maybe you can think about that for a little while. And I can also put down the other question, maybe to you, Geraldine, is I was looking at the news yesterday and I saw on Twitter, there's this photograph of protesters in Michigan, I guess, pressed up against a window. I think it's in Michigan. I mean, how are the Carolinas doing, North Carolina, when it comes to thinking about lockdowns and balancing public health with also the need for mental health for residents, but also the fact that people want to get back into the real world? So both you and Alondra for those two questions.
Yeah, so I'll take the second one. I mean, we had our own protest in the state capitol, Raleigh, yesterday. There was a coalition that sprouted up earlier this week called Reopen NC. Yesterday, Stay at Home NC coalition sprouted up. So we are back in our typical unfortunate pattern of partisanship and alternating between blame and credit in this entire situation, which is really frustrating for a lot of people just trying to do the good work and be innovative and collaborative, as Jason was talking about. So we have a lot of tension in our state on the issue of reopening the economy. The governor was one of the early Southern governors to issue a stay-at-home order. I think North Carolina was the second in the South to take this move. Some of our other states waited way into March to make this. So I think our state is a purple state. It's a battleground state, not only for the presidential election, but also for an important Senate seat. Our Democratic governor, Roy Cooper, has done a fantastic job, in my opinion, in communicating with local governments and communicating with the private sector, both on the relief effort and response effort, but also thinking about recovery. From a state legislator perspective, we have a Republican-controlled General Assembly with the Senate and House, both Republican-led, and there's been a great demonstration of bipartisanship, even though they have not been in session since December, and will come back in 2 weeks. So I'm really hopeful that we'll be able to collaborate and work together to think about the right path to reopening the economy. The governor's been very clear that it needs to be a data-driven, science-based decision. Even though we are not the type of hotspot that Louisiana and New Orleans is at this point, our curve has not necessarily been flattened yet. And so I think the governor is being very prudent, knowing that he is in a re-election campaign himself, to try to do what's best for the state and use the right data and metrics to make the decision as opposed to a political one. So I think there are a lot of people behind him, but there are certainly a lot of folks that are hurting and see that they want to get back to work, they want to get back to business, and it's just a hard decision. I think it's frankly unfair to our political leadership on either side of the aisle. I don't care if you're Democrat or Republican at this point. It doesn't help us to look back and to criticize decisions, because no one knows what's going to happen. No one knew what was going to happen in February. We really need to be focused on working together, more collaboration, more strategic thinking, And that's the piece that I don't think is there right now at all levels of government. And it's really, really frustrating to be on the front lines and not seeing that level of collaboration between local, state, and federal levels.
And just to jump in and piggyback off of Geraldine, I think what we've seen, especially in hindsight when we're thinking about this, and as more articles have come out recently, it's really about preparedness at a national level in terms of policy and having a response to a possible pandemic. If we think about Bill Gates and the Gates Foundation alone, in numerous interviews over the past several years, in fact, he alone has talked about the danger of a pandemic, let alone Dr. Fauci and other top officials. So we really going forward at both the state, regional, and local, as well as the national level, must be prepared for future pandemics and other crises, especially ongoing long-term crises. Second, I would really flag how this has shone a light on in all the fault lines and shortcomings of labor policy within the nation, and even the response to this crisis, the short-term response. We've allowed essentially so many workers to now be listed as independent contractors. And now we see what that means as we now label them as essential and necessary for the functioning of the nation. And at this time of a health crisis and now an economic crisis, as this morning has brought more news of over 5 million people filing for unemployment within the past week, the United States is being faced with an economic crisis that a lot of our European partners are not facing because they've taken measures to ensure that people still feel safe in their jobs and still feel safe receiving an income, which is now not likely for tens of millions of Americans. So I think these are two really big issues that compound the crisis in needless ways that hopefully going forward we can be much more mindful of and really prepare for, to make sure that our people have a safety net, as well as the nation itself is prepared for various crises.
So I have two more questions that are sort of related. And Alondra, you just mentioned about, funding for organizations. One listener has asked about the CDC and, if the CDC, the Center for Disease Control, has had adequate funding, and perhaps a lack of funding led to a little bit of missteps at the beginning. I mean, we'll have ample time to look back and see where mistakes were made. Like Geraldine said, it's time to look forward. But I don't know if anybody knows about the situation of the CDC beforehand, but also Christopher mentions something about a state stabilization fund. Perhaps Geraldine and Jason, you can talk about that. How are states going to be able to backstop, to have enough, economic power as you start trying to get the economy back on its feet? Is there a way to make sure that there's some stabilization efforts in your coffers?
Well, I'll touch on the first question and then I'll hit the second question. I think when we look at the CDC, and Alondra hit on this perfectly in his previous remarks, experts have been warning about a global pandemic for many years. And this is not a Democratic or Republican issue. The experts have been warning under Democratic presidents and Republican presidents, certainly as far back to President George W. Bush at a time when I was working for the US Senate. And so I think everybody, unfortunately, has blood on their hands, Democrat and Republican, because we should have ensured that the Centers for Disease Control was properly funded. And what we saw in the last few years, the CDC budget was grossly cut. And so the CDC, unfortunately, when this global pandemic hit us, started at a deficit. To no fault of their own. They did what they could with what they had, but their budget was cut at a time when it should have been very robust. So this pandemic caught us very flat-footed. And in many ways, we did not take the advice of the experts. In terms of a state stabilization fund, we currently in Louisiana, we are in legislative session as we speak. And our budget picture is looking very bleak. Not only are we getting hit from this global pandemic, but keep in mind, Louisiana is an energy, oil, and gas state. So our revenues in Louisiana rely heavily on the cost of what the cost of a barrel of oil is. And right now, because of the oil war that we saw in the Middle East and between Russia and Saudi Arabia, and I know OPEC just met and there's been some resolve, but it's going to take a minute for that situation to stabilize. The cost of oil is down, and our state budget heavily relies on that. So we're probably, we were initially going into legislative session in a surplus situation. Our surplus, our rainy day fund is likely going to be wiped out, and we're likely going to find ourselves, unfortunately, having to make some very tough decisions in cutting our budget. And so this federal government, and Louisiana is just one example, states are going to be grappling with this across the United States. The CARES Act, unfortunately, has not gone far enough in terms of stabilizing state and local governments. In terms of local government, the reality is in the city of New Orleans, our mayor is going to have to make some very difficult decisions, and we're going to find a large part of our city's workforce laid off very soon if we don't get federal help. And we're going to see the same thing at the state level. So yes, we do need a robust state stabilization fund and local stabilization fund, and hopefully Congress will see that happens, and there can be some collaboration between the Congress and the president at the federal level.
Geraldine, do you want to weigh in this? I mean, maybe one question that's come to mind for me as well is that, you know, sitting here in Europe, you've seen how this coronavirus pandemic has led to sort of a fallback to nationalism. And even in the United States, states are looking out for their best interests, which is correct. Governors have to take care of the citizens in their state. But now moving forward, you've seen talk of states working with each other, like, you know, New York and Connecticut and New Jersey, and also California with Washington State. When will this be essential for lowering restrictions? I mean, when is the point going to come when regions will have to work together?
I think we're there now. I think regionalism at the sort of metro region scale that I work with, you know, one of our main objectives in terms of the role that our organization plays in this crisis is trying to bring our local government leaders together to talk together about, for example, when probably about a month ago, before the governor ordered the statewide stay-at-home order, we were talking to our local, our county officials to say, okay, are you going to issue an order? Because what happened is the county started in a very piecemeal fashion to issue those stay-at-home orders, and 60% of our workforce in the Charlotte metro region lives in a different county that they work in. So you had a workforce that was saying, well, wait, can I leave my home? Am I essential? There was such confusion. So our role was to bring people together and say, okay, as a region, what are you all thinking? What is the unique situation in our area, and how can we work together to send a consistent message? So that was about a month ago. Now what we're doing with our local government officials is saying, how can we help you? What are the challenges that you're facing? For example, some of our local governments don't have furlough policies for if they run into tight budget situations and they have to put you know, employees on administrative leave without pay. They don't have a personnel policy in their books to be able to do that. So our role has been have one local government write a policy, we review it, and we share it out with our 68 local governments so that everyone can benefit. So those are just two really small examples of how to, you know, just like producing hand sanitizer out of distilleries, it's about finding what people need, solving that problem, and then scaling it. And I think that's the type of thing that we need from leadership in the recovery phase. We need a national project, we need a state project, we need a local project that says, what are the best ideas that we can draw upon to move ourselves forward? How can we share that information and those innovations so that we can scale ideas and start to move our country forward and our states forward and our local governments forward? Because right now it's just too much about taking credit for small things and shifting blame for other things. And it doesn't do us any good, frankly. It's not a strategy. I think we need a strategy. The people who do well in certain areas need to be deployed to do and deploy those talents to work on that. And other aspects of civil society, private sector government need to focus on different areas. And that's the piece that I think is missing. And I think a lot of places are developing those strategies themselves, but it has to be coordinated across all levels of government.
One element of perhaps a national strategy, one listener just posed a question about public information, so like PSAs, especially for vulnerable communities. Alandre, I mean, is there a way that you think either on the local level or state level that there should be public information campaigns for those communities that are being so disproportionately affected? Is there, especially, you mentioned disinformation at the beginning of your remarks too. That's also something that we have to look at.
There's a strong need for that level of communication. And I think that is happening in a number of ways, especially kind of at the national level. For instance, just watching TV, for instance, now there are plenty of commercials encouraging people to stay at home. Where I think that I'm seeing the biggest gap is actually kind of at this local level, where you do in fact still have a number of states encouraging large gatherings such as church services in particular. But then also right now in this moment, now that the lockdown has gone on for several weeks, you have a number of governors who are quite reasonably itching to reopen the economy. And I think we're running the risk of doing so prematurely. And because of that deliberation that's currently happening, I think a lot of households are getting mixed messages about how seriously they should be taking the social distancing, especially in light of their other concerns in terms of family members, in terms of making a living and just resuming a normal life. So I think the biggest gap in communication and the biggest opportunity for really reaching out as at the local level and local leaders who have a much more kind of direct impact on citizens. For instance, if you still have your pastor encouraging you to come to church services, even if you're social distancing throughout the week, if Sunday morning you go to a building with 100 people, it's ruined everything that you did for that week. So we really do actually need local leaders to step up and really kind of take charge to really kind of spread that message and really make sure that it's effective as possible.
Well, then, Jason, we'll give you the last word. Speaking of local leaders, yeah, unfortunately, your city has been through so much, hurricane, natural disasters, and now this pandemic. What's the trust in local leadership in your city right now? Like, how do your citizens feel? Do they feel like they're in good hands?
Yeah, absolutely. Leadership matters at the end of the day. And I can say our mayor has done an extraordinary job. And I think you're seeing that from local mayors across the United States. Democrat, Republican, really doesn't matter. Mayors have really stepped up. They are leading. But the citizens of New Orleans really feel like they're in good hands. We know that this is going to be a tough road indefinitely. But as we always do, we lean on each other. The citizens of New Orleans are resilient, and that's all across America. And so, as I remind my constituents on a daily basis, look, this is tough. It's going to be tough for all of us in the short term, but the sun will rise again. And I have no doubt that in New Orleans, that streetcar is going to once again roll. The second lines will once again roll through the street. The oysters will once again be shucked, and we will see those cruise ships on the mighty Mississippi River rolling again. So brighter days are ahead. And you're seeing, collaboration amongst mayors and amongst governors. And, for once in America, this is probably one of the least partisan times that we've seen. You see leaders just working together for the sake of people. So I'm hopeful about the future. It's going to be tough, but we'll bounce back.
Well, I want to thank all of you for your thoughtful responses, and what a hopeful way to end this conversation with Jason. Yes, there will be better days, and all of us should go visit New Orleans when there are better days. I wish you all good luck back home. It's good to hear what's going on and how communities are coming together and how mayors are stepping up Thank you all. Thank you all for listening too, those that are still on the Zoom call. And I'd also like to give a shout out to my two colleagues, Sophie and Zach, for organizing this week's coronavirus update. Have a great day, and we'll see you soon. Bye-bye.
Thank you.